Good morning, good afternoon, and good evening from wherever you are. This is Michael Connor, CEO and founder of the Agile Evolutionary Group, but more importantly, the host of Voices for Excellence. Again, I would like to say Happy Black History Month. And this is a very, very special month, not only recognizing the history and the contributions that Blacks have made in our past, but also the continued work that they will make in the future. And I have a special guest today. And this guest I wanted to bring in specifically in the month of February, because we talk a lot about mental health, right? And we talk a lot about self-care and being able to ensure that you be able to know when you need that help, right? And I know that a few of my colleagues broadly and nationally have always talked about it's okay to seek help. It's okay to ask for that. It's okay to be able to say, hey, I'm struggling with something. How can you help me move forward? And, you know, we have seen this as Black males, right? That we don't necessarily at times reach out when we need to reach out for support. So I wanted to bring this to awareness, not just from the Black male standpoint, but everybody's standpoint, where we have to have a time where if we do need help and seek that help to be able to reach out. So that's why this episode today is focusing on that. And I got one of the leading psychologists in the country. Yes, when people come on Voices for Excellence from an asynchronous manner and to be able to apply strategies and go back and listen, you're going to have the best. And I wanted to bring the best on. And it is so good to have one of my colleagues, a dear friend. I try to use this time before the actual recording because I wanted to say, hey, you know, Dr. Ranger, I need to talk to you. I need at least 10 minutes. And she said, boy, let's just get to the recording. So she shut me off right away. So I have one of the leading clinical psychologists in the country. She's out in the Las Vegas Valley area. Not only is she just one of the leading clinicians in our country, she is also a consultant and is an author of 2 books where we got to exchange each other's book at the Education 2.0 conference and was able to sit in on her session and listen to her panel. So without further ado, I would like to welcome the esteemed Dr. Tanisha M. Ranger. Dr. Ranger, my sister, how are you? Welcome to Voices for Excellence.
Thank you for having me. I'm incredibly nervous, but let's do this thing.
Incredibly nervous. Come on, what you talking about? I'm the one that's supposed to be sitting in your chair being nervous, but you know, you have all the strategies and the methods and everything, but it's just so good to have you on here, Dr. Ranger, especially an important topic that we need to be able to unwrap in this episode.
Absolutely. Absolutely.
All right. But okay, go ahead.
My dreaded question. Okay, go for it. Go.
Your dreaded question. Now, I'm not going to lie, everybody. I sent the questions to Dr. Ranger. And Dr. Ranger, out of all the questions, you would think one of the technical questions around clinical psychology work, mental health, and inclusive environments and belonging in our pre-K through 12 sector, you would think those questions would be the hardest. But Dr. Ranger asked me that, wait, we gotta, this is monumental because you are one of the smartest individuals I know. The hardest question was the first question that I am about to ask her. And the question I'm gonna ask her, and I can't wait to hear her response, is, what is your equity song when people see Dr. Tanisha Ranger walk in a room? Now, when they see Dr. Connor, Dr. Ranger, they think of James Brown Superbad.
I mean, the suits are, they suit. Okay, so I can understand why that would be your song. Great suits.
What's your song? What's your equity song, Dr. Ranger?
Okay, so I just immediately 5 seconds ago changed my mind. So the song that I have chosen is Short Skirt, Long Jacket by Cake. And I love that song because it is a song about a woman who gets things done. and you generally don't want to mess with her. And I have always tried to embody that energy. I don't like to fight, so I like to just give off a vibe like it's not going to go well for you. So then people leave me alone.
I love it, Dr. Ranger. Oh man. And I tell you, to our audience, Dr. Ranger and I, we've had some really, really, really good conversations, even about education, right? Education pertaining to where we're at in the AC stage of education, right? But we'll get into that further into the interview. But you have such a successful practice in the Las Vegas area, Dr. Ranger. So many people just whether reach out to you, whether from a clinical standpoint or just saying, hey, I need strategic advice around this area pertaining to social, emotional, and mental health. But, you're one of the sought after leaders in our country in this thread. But in your practice, right, if you could just explain to our listeners, what's your specialization? Why are you so sought after from the context of bringing these equity-driven methods into the psychology area? So, and what would I experience if I was, or what would I experience if I was one of your patients?
Okay. So my practice is growing and evolving. Currently, the work that I do the most and the work that I love the most is around working with people who are adult children of addiction, abuse, dysfunction. Because what I was seeing when people were coming in with mood disorders, problems in their relationships, problems at work, a common thread of a very dysfunctional childhood that left them ill-equipped to deal with world as an adult. So that's become my specialty because it just comes up so much. And so, and I specifically love doing that work with Black women, because as Black women, we're often thinking of mental health concerns last. Mostly we feel like we're failures. Mostly we feel like we're not doing enough. Mostly we feel sort of empty, and we're reaching all the goals that we're supposed to reach, but it doesn't feel good. And then when you come to realize that is because those were never my goals, that was somebody else's stuff that they put on me, that's the work that I'm doing the most. I also have a certification in sex addiction therapy, and so that's also a large part of my practice, and working with people and sort of healing the wounds around compulsive and problematic sexual behavior and the negative impact that it has on their life and on the life of their family and friends. And so those are the two main things. I do a lot of work around being present and, in fact, befriending your emotions, because so many people are afraid to feel their feelings. I've had so many people tell me, like, if I start crying, I'll never stop, which is a valid concern because it does feel that way, but that's generally not how it goes. But, just embracing the entirety of yourself, all of the emotions, all of them, even the ones you don't like.
Yeah, and
So, mhm.
no, go ahead, Dr. Ranger, because you're touching upon a lot of points, and one that you said that just resonated with me immediately: befriending your emotions and embracing
Mhm.
your emotions. And no lie, the pandemic, the novelty of the pandemic, created some explicit variables now that we're seeing with a lot of people, and is the emotions and that we're feeling and the things that we're feeling in society right now. So that just is
Yeah.
captivating.
So the pandemic played a really pivotal role because it forced everybody to slow down,
Mm.
like grind to a halt. There are a lot of people who were getting by not dealing with their emotions by staying busy. There's no busy in a lockdown.
Correct. Yeah.
And so that is probably the time period where I got the most calls, because people are legitimately coming face to face with things that they have been avoiding for a really long time. And like, as a planet, we were going through something, and some of us were willing to acknowledge it and others were not. And it was getting really, really difficult emotionally, because
Yeah.
that depression, that anxiety, worries about the unknown, not knowing when it's going to end, if it's going to end, are we all going to die here today? Like it was really stressful, and you didn't have the ability to run anymore. And that made a big difference for people.
Yeah, and Dr. Ranger, I want to underscore three meta themes you highlighted: depression, anxiety, and the elements of the unknown. Right, and we've seen the data nationally in the education sector, right, where we've seen increased fights in schools. 211 calls were at its highest level within the what I call the reality year, which was the last year before the AC stage of education, which is this year. We saw the greatest number of suicide intervention calls between the ages of 15 and 18. So when we talk about depression, anxiety, and the unknowns, right, we know that mental health has been a high priority within our schools. And let's be honest, right? Limited resources comprehensively to address this. So
Yeah.
for leaders, right, Dr. Ranger, that are out there, teachers, school support staff that might be listening in today, what advice or strategies would you provide our audience to address these priority issues when it comes to wellness and school and organizational culture?
I think that school culture has to make a huge shift. I think that there are too many mental illnesses being treated as just flat behavioral problems, and that concerns me because it just is beginning a process of children feeling something big that being invalidated, and then they don't know how to manage or process it. I saw a study, and I don't have it with me, I apologize, where they started implementing daily mindfulness meditation with all of the students. So we're not pinpointing which kids have concerns. This is for everybody. And they saw that, aggression went down, that, lots and lots of punishment went down. And I think that there's something to be said for treating children as whole human beings,
Mm.
that they are not simply there to follow instructions and behave, that they have thoughts and they have feelings, and those things matter, because there's nothing more helpful to a child than to feel like they matter. And
Absolutely.
so I would say, if your school can implement something that's school wide, that is taking time out for mindfulness meditation. And when I say mindfulness meditation, it's not like, sitting, chanting, you're not becoming a monk here, but just taking some time to be present and breathe deeply and allow yourself to be calm. That has shown to be really helpful for children. And so if administrators could implement that, that would be great. But outside of that, um, nobody knows kids better than their teachers.
Mm.
And I think that sometimes teachers are not necessarily being listened to when they say something's off with this particular child. Um, and so I think kind of a see something, say something, if that makes sense. If you
Absolutely.
notice that this child is usually one way and then all of a sudden they're a different way, talk to them, address them. If you need to bring in mental health staff to facilitate those kinds of things, that would be great too. I think the time away from peer interaction, um, it's taking a little bit of time for kids to readjust.
Yeah.
Um, and the world is not the same as it was before.
Mm.
So there's just a lot of patience is necessary, which, all of the studies tend to really show that there's not a lot of patience for Black and Brown children.
Mm.
Um, but they need it the most at some level.
I concur when I unwrap this metric, right, for Generation Z and Generation Alpha, specifically Generation Alpha, where my song belongs into that age 7, 50% are Black and Brown, where I believe roughly around 15 to 16% come from non-traditional homes, right?
Mhm.
So now we have this pandemic and the ramifications and the future
Yeah.
implications about this with Black and brown students not really being focused on that, where now, it's been a lot of reaction to some of these behaviors that we're seeing. And you're
Yeah.
calling for school-wide practices. When I think about, as a former superintendent, a broader question I start asking is, how do I integrate this into my multi-tier system of support, right? We have academic MTSS structures. Now, what will mindfulness and that cooperation be in a blended and interfaced manner? So that should be like some of the innovation when we start thinking about that. And then resources, right? Strategically aligning resources to be able to help students from that mental health, social emotional learning, but more importantly, providing the necessary human resources, I like to say, within our schools to
Yeah.
address this. Because let's be honest, our teachers, they say yes, something's not, so Johnny and Jane, they're not right today, right? But our teachers are not prepared as clinicians like
Like
you.
what to do about that. Yeah.
Absolutely. So we run in this reciprocal spiral where we know something's wrong, but we can't critically diagnose it and have the necessary interventions. So I would say too, a strategic investment of superintendents in this area, so that now our teachers are the practitioners, right? But also they're not the clinicians to address some of these systemic behaviors in our
Right.
classrooms.
They're
You talk
like
about that.
they're like the canary in the coal mine. Like they are the ones who are going to be the first to recognize that there's a problem. And
Mhm.
then if you have like a protocol, if you have those human resources available, you can bring somebody in or somebody who's already there who can address it directly. Because I don't think it would be fair for a teacher with a class size of like 30 kids to be like, okay, this one kid has a problem, let me focus on them, because that's not exactly fair. But to be able to say, there's something going on with this kid, let me get some support, that would be the ideal way to manage it.
Absolutely. And I think about this is that, in the AC stage of education, Dr. Ranger, and this is the first typical year since the 18-19 academic year, I think that we can't allocate resources the same way we used to in what I call the BC stage of education before COVID. So that's where now strategic investments in this area is so important. And that's why you're on this episode. But just moving along, right? Because we talked about Black and brown students, and now, let's talk about Black and brown students, Black and brown adults, adults participating on this podcast right now. And we know that the novelty, right, the elements or the ramifications of the pandemic has basically forced our most affluent families to look at equity different. I'm starting to hear people and see people talk about equity that I never would have imagined, right? Talking about equity and justice work. But your core practice, right, being a psychologist, has always underscored this evidence-based approach rooted in excellence and equity. Always said that. And that's why I wanted you on here, right? Just even your focus on Black women is just is exceptional, phenomenal, right? But this right here, how do we push this from the context of embedding this cognitively within our systems? How can we root this as an equity-based approach with mental health supports, right? Because your approach, let's be honest, right? This is innovation. When we talk about the clinical work that you're bringing in, specifically some focuses around adult learners, Black women per se, right? That's the innovation in itself, because in this space, in our space, Black and brown was always left out. Now you're reemerging it back in. So what does this look like in practice? And how will it advance the most marginalized, which is Black and brown students, Black and brown men, women that have been impacted by the pandemic?
I think in practice, it looks like a strong focus on paying attention to what's going on with yourself, right? Because, like I said before, people have had an opportunity to run. They did not have to deal with it. They could work 60, 70, 80 hours a week. Students are in class, then they're in extracurriculars, they're playing sports, they're in a band. Like there's just a pervasive sort of societal agreement to, as much as we can, ignore emotions. And moving away from that and back to a place where it matters how you feel. Your emotions don't have to drive everything that you do, but they ought to be informing what you're doing, and I think, when it comes to equity around mental health, especially in schools, I trained as a school psychologist. I decided not to become one, but I trained as a school psychologist. I worked in a school, and I recognized that there are not enough school psychologists. There
Mm,
are way too many students per school psychologist, and that's leading to a lot of burnout.
mhm,
I also worked, before I got my degree, I was what they call therapeutic support staff in a school. I was one-to-one with a child who had emotional, mental health, behavioral problems. That's a rare job. I don't know that we have that here in Nevada. This was back when I lived in Pennsylvania when I was in grad school.
mhm.
And the idea that a child could have someone that was dedicated to making sure they're okay and recognizing their signs and teaching them to recognize their signs and know when they need to back away from a situation, and before it gets escalated, recognizing their own triggers, like that is the kind of work that is really necessary in schools, but it's not available most places. um I will admit it didn't pay that well. So I can imagine that a lot of people are not necessarily like running to do it, but that is also another issue. Like, if we can encourage um, more professionals to go into this field by
Mhm.
making sure that you can earn a living doing it, you would have more support in the schools. But I mean, we can barely get them to pay teachers what they what they deserve to be paid. So I that's kind of pie in the sky, I guess.
No, no, I listen, I concur. And this is going to be a very, very biased statement. Teachers should be paid $1 million. And why I say that
Listen,
is the impact, the importance. If you want to talk about support staff as well, our para educators,
mhm,
the people that are in the buildings, right? And they're underpaid for what they're doing. And I'll say this for the whole sector of education, because what our teachers did during the pandemic to be able to flip a model in less than 14 days. And
superheroes.
yeah,
Like,
absolutely. And it took a
that's
lot out of them. Took a lot out of
yeah,
them.
it still is.
It is a huge amount of work, but you said something, Dr. Ranger, that just caught my attention, right? Understanding the emotions and recognizing signs and triggers. If every student was to, or we build some type of cognitive vertical model that emulates mindfulness, right? That emulates Dr. Brackett's work, your work as well. I could see, education changing just from that dynamic focused on the broader theme of culture. Wow, understanding emotions. Can you just elaborate on that? Because we have a lot of listeners who are educators, but understanding emotions pertaining to them as well, because let's be honest, we as adults, Dr. Ranger, we have signs and triggers that gets us to be emotional, right?
Yeah.
And I know that this is a part of the self-care question, but how could just our listeners strategies to truly understand their emotions and to move away from some of these triggers, because I really want to expand on that for their own self-care.
So I think that it is not difficult for us to get in touch with our emotions, but it is a little frightening because there are a lot of messages out there about which emotions are good, which ones are bad, which ones are helpful, which ones are harmful. And when we start adding value judgments to our emotions as human beings who are, driven by the pleasure principle to seek out pleasure and avoid pain, we're going to try to avoid the more painful emotions. And that leads to huge problems because your happiness and your sadness are both necessary. We
Mhm.
can't selectively numb emotions. You can either feel them all or you feel nothing. And a lot of times people are so concerned about their emotions that they will opt to feel nothing. But that means that you're not getting the signs. You know, there's a psychologist, South African psychologist that I love her book. Her name is Dr. Susan David, and she really articulated the things that I've been saying, which is that your emotions are messengers. They are there to let you know what's going on internally and within your environment. They are messengers. They're data, but they're not necessarily directives. They are not
Mm.
supposed to drive every single thing you do, but they need to inform you. And if you don't have a connection with your own emotions, if you don't know, how do I feel right now? What is going on for me? Then you don't have the relevant information. And so when I say understanding your emotions, for some of us, we got to get out that wheel. I don't have it with me. I have a whole floor pillow that is the emotion wheel because I am a nerd. uh, but to really start inquiring, interrogating. I like Sometimes it's like I feel irrationally upset right now, and for me, I can say that at any moment, but other people don't necessarily know when they're upset. I've said to someone, wow, like, wow, you seem really upset. And they're like, I'm not upset. And I'm like, okay, well, I mean, you said that in a way that indicates you might be. But we're so detached because we've attached these value judgments to our emotions. So if I'm angry, especially as a Black woman, right? If I'm angry, that says something about my entire being, like not just that something has happened that, usually the response to boundaries being violated is anger. It's a natural response. It's a human response. So rather than someone being like, oh, something happened that made this person angry, for most of the time with Black people and brown people, they'll be like, see, they're just angry people. And that's not a real thing. That's not how that works. We are all able to feel our emotions without becoming the emotion. And I think that when we can decrease our fear of what might happen with our emotions, then we can give ourselves a little bit more freedom to connect. However, I will not act like all of this happens in a vacuum. There is not a lot of leeway for Black and brown people to express and feel and explore their emotions. We have a lot of pressure. Um, and so, I recognize that that's problematic, but, it's still worth the trouble for you to understand yourself, because you can't control your emotions. You don't control your thoughts. What you control is what you do with them, how you interact with them, how you engage them, and whether or not you let them take over.
Yeah, and Dr. Ranger, you hit upon a critical point that I just want to expand upon for a minute, specifically our Black and brown leaders, and specifically when we talk about Black women in leadership as well. We carry a different emotion every single day, right? And in a leadership role, we're carrying that burden, and that burden that constantly is coming at us, right? Whether it be, implicit or explicit racism, or implicit or explicit biases that we see. I always say that, we get bit by comments like mosquito bites all the time, that people don't even realize that their comments are hurting us. So, and I just want to just expand upon this, right? For our Black and brown brothers and sisters, self-care. Well, I want to get to your books in a minute, but self-care, right? This burden that we carry every day. And, when you say, feel our emotions, a lot of Black and brown leaders are carrying this heavy laden burden of emotions that we get beat up every day, Dr. Ranger. What does self-care look like for our Black and brown leaders that are on here today participating in our episode?
I firmly believe that specifically, I mean, it probably applies to everybody, but specifically for Black and brown people, self-care starts with community,
Hmm.
because the isolation of not having people in your life that you feel you can trust and confide in, not feeling like you're known by anyone, not feeling necessarily like you're important to anyone outside of a role that you play for them, not just like you're important to them because you make sure that they're fed or that kind of thing, but just someone
Right.
who like just is your person, you know. And I do want to talk about burden because I think that comes up a lot around relationships in terms of friendships, romantic relationships, familial relationships, where people say to me all the time, well, you know, I'm not doing great, but I don't want to burden people with that. And my unpopular opinion is burden these people. Okay. This is what we sign up for. When we get into relationship with people, I am your burden and you are my burden. I'm here
Burden
for
these
you.
people.
You're
I
here
love
for
that.
me. Burden them because I would much rather you burden me with your bad mood than have to show up at your funeral, right? Like it's not helpful to view it in that way because that just means you're alone with your thoughts. And your
Mhm.
thoughts are not facts, but you will certainly believe them if there's nobody else to challenge them, right? I always like to
Absolutely.
say, you know, being alone with your thoughts for too long is like walking alone at night in a dangerous neighborhood. Like it's just, I advise against it. It's because, you know, especially if you're not doing well, if you're not feeling well, if you're struggling, your thoughts will take a negative turn and you'll just believe that those are the facts, you know.
Yeah.
And so I think for Black and brown people, you know, I think in our soul we're collectivistic and
Mhm. Mhm.
community is one of the best forms of self-care. And I mean a good positive community, people who support you, people who will challenge you, people who love you but are not going to let you be out here looking stupid. Like, you know, really having people that you can trust and confide in, who can trust and confide in you, is like the base, like the foundation of self-care. And then the other parts of it, you know, in the general media, people talk about self-care as like, you know, getting a massage and going, you know, get a facial, going to do this or do that, which is great. I love that stuff. But it's also keeping up with your doctor's appointments, making
Mm.
sure you're getting screenings. You know,
Mhm.
don't be away from the doctor so long until you feel like you're gonna fall apart, and then you go in to find out you're like stage 4 colon cancer. Like you could have addressed this earlier
Yeah.
on. But you
And
know,
you
like
know, Dr. Ranger, I
mhm,
just want to interject really fast, and I just want to say this to our listeners, our Black males. I know that we have a tendency of not going to the doctor.
yeah,
Please see a physician. Your yearly checkup or your regular physical that you have, please, because Black men are notorious not to go to their physician, and we find out something later when we could have been preventive, especially my Black male superintendents, principals, in any type of leadership
yeah.
position. Please, if you're doing the work, and I know everybody here doing the work, please regularly see your doctor. Go ahead, Dr. Ranger, I apologize.
I mean, that's a really important key. You know, I've known people in my life who have been just so busy, they're work, 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 and nothing will slow them down unless it's something really dire or really drastic. And you don't want it to be dire. You don't want that to be the reason. You want to, you know, you take your car in for checkups. Why you can't go see a doctor as well? And so self-care is around making sure your physical health, and I'll also say your financial health, you know, doing an audit. Where is your money going? How is your money coming in? Are you preparing for your future? Like all of this stuff is self-care. And I think that, you know, we do ourselves a disservice when we just limit it to, you know, facials and bubble baths. Because there are other really important parts of self-care, setting your goals and then holding yourself accountable, allowing other people in your life to help you with accountability. Like that's self-care because we feel good when we do things that we can be proud of.
Absolutely. Dr. Ranger, thank you for touching upon that because so important, right? But I think I'm going to adopt this quote, and you better copyright it.
Uh,
Burden them. Burden these people. I love it. Copyright it immediately, right? Because it is so true with that. But get into your books, and I use that in a plural sense with the S
yeah.
at the end, not a book. See, I'm still a neophyte, and I have my first book out. You are a veteran. You have two, right?
I
Many of white
mean,
papers.
in reality, both of those books were written last year. So, I mean, it's not like I've been at this.
But listen, you got two. I'm only on one. I'm still learning from you. But your two books, right? The first is non-toxic positivity: how to combat the tyranny of positive thinking and craft a genuinely authentic life and find your person, right? That, oh no, authentic life. That's the first book, right? And then the second book, which I just love the title. Love it, Dr. Ranger. It says, Find Your Person, the busy Black woman's guide to finding the right therapist. Woo! That right there, just the
Yeah.
title by itself
Mhm.
is progressive, provocative, and it catches your attention, right? The busy Black woman's guide to finding the right therapist. I mean, that just hits home. But when you think about that, right, that is so true. Now, if I'm doing an introspective analysis of myself for growth and healing, how would I be able to use your resources, those two resources, to be able to seek what I need to find a therapist, or even strategies around approaches that I can adopt, using this equity driven focus around healing, right? So how would your books help me reach
Okay.
that level of introspection that I need?
Okay. So, finding your person is specifically, although not exclusively, for Black women, specifically because that is that was a labor of love. In my circles, I am the person that people go to when they're like, I need a therapist. How do I find a therapist? I've been answering that question to my friends and colleagues and acquaintances for years at this point.
Yeah.
And so what that book does is it explains what the therapeutic process is, because for Black people, we have a long history of being abused by the medical field in this country. And I don't want that to be the thing that prevents someone from getting the help that they need. And so that book is really about doing some introspection about where are you at, figuring out what matters to you, right? Does it matter if your therapist is older or younger? Does it matter if your therapist is male or female? Like, does it matter if they're Christian? Like, really figuring out what is it that matters to me and focusing on that, letting that be the guide as you go out and go forth. Now, I'm biased. I do feel like Black people should have Black therapists. Maybe that's controversial. I'm fine with that. Because I do think that there is a level of understanding, even amongst Black people who do not have similar backgrounds, in terms of how they grew up. There are just some things you don't have to explain to your Black therapist. That just is what it is. Um, like you can speak in song lyrics and they'll know exactly what you're talking about. But recognizing that, one, we're out here as
Mhm.
Black professionals. Now, I think that Black psychologists make up maybe 2 to 4% of psychologists in this country.
Wow.
So we are hard to come by,
Wow.
and but we're out here.
Yeah.
And psychologists are not the only therapists, so if you add in social workers, marriage and family therapists, counselors, you have a bigger pool of people to choose from. But the first part is to recognize, what am I seeking help for? And you don't have to be super specific about that. Just have an idea of what's wrong. Why am I thinking about calling someone now? But then to really think about what matters to me. What matters to me in the person that I find, without judgment. Because I think sometimes people, you know, may judge themselves for being like, I don't want no young therapist. I'm sorry. I need somebody that's older and seasoned and, is giving me grandma vibes, but they don't want to be, I don't want to exclude people. Exclude people. This is your healing. This is your health. And it has to be driven by what you need. The next part, though, which is the questions that I get asked the most, is once I, generate a list, what am I supposed to say to these people? Right?
Mm.
So in my Finding Your Person book, I have a list of preliminary questions. Like, it's a pretty long list of questions to ask during that first phone call, during those first few sessions, and to make sure that you feel comfortable with this person, because this is a very intimate journey. And
Mhm.
if you are sitting in that room like, oh, I can't say this to them, you're already putting up roadblocks.
Mm.
You are making it difficult for yourself to get what you need. And I don't know, I tend to cuss a lot. I've really reined it in for this, but the thing that I tell people the most is you do not owe that therapist shit, right? If you do not feel comfortable, then
Mhm.
you say to that person, I don't really feel comfortable. I'm going to look elsewhere. And that's it. Because as therapists, we don't want to hold on to somebody who's not being helped. That's not why we got into this. We
Right.
want to make sure that we are giving the people what they need. And I know for me, if I'm not a match, listen, I know a lot of people. I'll give you some referrals. But
Mm.
don't feel like once you've settled on a person that now that's your person, you have to see them forever, even if you're uncomfortable, even if you're holding secrets from them, even if you don't feel good after you leave the sessions because it feels like they were judging you or whatever the case may be. You don't have to volunteer and endure that. That's not what your healing journey is about. And so that book is really about taking that introspection, figuring out what matters to me, and then holding value to what matters as you go forth and look for a person who's going to help you on your journey to wellness. Now, non-toxic positivity was a little bit of a frustration book because I got so sick and tired of people being invalidating about other people's emotions. As I was writing that book, it was so interesting to me
Mhm.
because toxic positivity for me is this this artificial insistence on being positive
Mhm.
about everything, about life. you know there God has a plan, and eh, you know uh I don't know, all of that stuff, no bad vibes, all good days, all that stuff that people say that is patently unhelpful to someone who is dealing with an emotional state. What I found when I was writing it was I was going through some stuff. There were things that were happening around me that were really, really frustrating. They were really pissing me off. Like, it was coming down to a lot of people not doing their jobs appropriately, and it was negatively impacting me. I don't like that. And so someone would say, how are you doing? And I'd be like, well, not great. you know, and they're like, oh, what's up? And I'll tell them, they're like, oh, I mean, the number of times somebody told me to calm down and I wanted to throw a chair, like, what is happening right now? Why would you ask me how I'm doing and then make it go away? Don't do that. Don't do that.
Right.
And so, like, that that was happening while I was writing the book, where they're like, oh, it's gonna be okay. God has a plan. You gotta stay positive. And I'm like, listen, I'm having emotions that are appropriate to the situation. And if you
Mm.
can't handle that, you can go on and leave. But what you're not going to do is prevent me from feeling my feels. Because if you don't feel your feelings, then they don't pass in the time that they generally would.
Wow.
All of the time that you spend fighting to hold things at bay just prolongs the suffering. So if I'm in a situation where it's a aggravating, infuriating situation, and I feel aggravated and furious, that's fine. It'll pass. I'm not going to use it to justify, committing violence or anything like that. I'm just going to feel my feelings. I'm going to be mad. I'm going to probably yell about it. I'm going to rant to somebody who I know I can trust to rant to. And then once it passes, then I'll be like, okay, next steps. But it's It's when people try to move to next steps, they try to move to silver linings, they try to move to everything happens for a reason before you've even had an opportunity to process what's going on, that leaves people feeling invalidated and isolated and like they can't talk to people. That's the kind of thing that makes someone feel like you're a burden to them. When they try to talk to you about something painful and you're like, oh, it's fine, it'll be fine, it'll all work out. It's like, oh, okay, you don't want to hear about this. You don't actually care. And that leads to people feeling very isolated and alone. And so non-toxic positivity is about allowing yourself to feel things and allowing it to help you create a life that feels purposeful and worth living. And there's also a portion in there about when the call is coming from inside the house, when you're minimizing your own stuff, when you're telling your own self these messages, and you're invalidating your emotions. And so the big part of that is practicing self-compassion and allowing yourself to feel your feelings, recognizing that you're not alone, that these are kind of universal things, and treating yourself with the kindness that you would treat a friend.
Absolutely. No, Dr. Ranger, I tell you, I wish I can have you go on and on and on and on. I'm just sitting here just writing down notes selfishly for myself as well as for our
Gotcha.
listeners out here. I know, Dr. Ranger, I'm stealing all I can for free.
Dang it, I told you I wasn't going to give you nothing free.
Oh man, that's why I love you, sis. But last question, right? And this is the question I ask all of the participants or the guests on Voices for Excellence, where I try to attempt to limit our guests to 3 words.
Uh-oh.
For the past couple of episodes, it's been 3 plus. Last episode, it was, or it's, a couple episodes been 3 times. So now I'm going to say, if I could limit you to 3 words, but I know it's going to go on longer than 3 words, but carry on however it is. But what 3 words do you want our audience today to leave with, capturing the whole totality of our conversation? What do you want them to leave with regarding excellence, equity, and innovation, right? When we talk about innovation, specifically focusing on mental health, wellness, and our emotions. What do you want our participants to leave with from this episode?
All right, I'm going to try to respect your boundary. I think the first word that comes to mind is courage, because taking care of yourself, focusing on yourself is a radical act, especially among people in a field that is termed a helping field. Teachers are not meant to take care of themselves. Therapists are not meant to take care of themselves. They shouldn't focus on themselves. They should focus on helping. And it takes a lot of courage to say, that doesn't work for me, generally, for anybody. And I'm going to take some steps to make sure that I'm okay so that I can take care of the people that I intend to take care of. So courage is the first one. I would say rest. I know I didn't talk too much about rest, but rest is incredibly important.
Absolutely.
I think as much as we have toxic positivity, we also have toxic productivity. And recognizing that not every single moment of your life needs to be something that's productive, needs to be something that's toward a goal. Allow yourself some rest, allow yourself some non-goal directed joy, and to be able to replenish so that you can face the day, face the week, face the month. You need to be able to rest and rejuvenate and replenish your stores and your reserves, because otherwise you're an empty vessel and you're just squeaking by. Like you're only able to do the bare minimum, if that. And then you don't feel good about that. Then that starts a cycle of negative self-talk, beating yourself up. Probably is going to lead to some depressive symptoms and sadness, and it's a big cycle. So I would say courage and rest. And then the last one being joy,
Hmm.
because joy is mandatory. It is not optional. You have to have it. Um, I feel like you need to have it every day.
Mhm.
But I have a definition of joy that may be a little looser than some people. I'm not talking about boisterous, like I feel great, but just like, I watched this thing on TikTok and it made me laugh until I was in tears. And so I'm good. I had some joy today. Like allowing yourself to just have pleasure, um, and making it an integral part, as much as work is an integral part of your life. So I'll stop
Absolutely.
there.
So we got Kurt. So that was 3 times 33. So we got, it's getting better. It's getting better on the last question. I'm
Oh,
gonna try to
I just wanted to explain.
listen, that is Dr. Ranger, you take as much time as you want. But courage, rest, and joy. And I think a lot of us need that at this time, right? Especially this journey to wellness. And that resonated with me, everything that you said. And having our emotions be messengers. Wow, messengers as data on how we feel right now. And I think that from this conversation, a lot of people can take a lot of strategies, both whether it be from the school context or even from the individual standpoint. But Dr. Ranger, we know that there's 2 to 5%, you said, of psychologists, social workers across the country. And you have a strong belief, which a lot of people have a strong belief, where Black psychologists or Black individuals should see Black psychologists, just from that cultural context. But a lot of people have have a hard time finding those psychologists. So we know you have a really deep network, Dr. Ranger. If I wanted to reach out to you, right, whether you're in network or you're not in network, or even broadly making these references, how would I or our audience get in contact with you?
You can contact me through my website. That's usually the quickest. My practice is called Insight to Action, because that's what I do. And so insighttoaction.net, all words spelled correctly, uh, is my website. And you can send me a message there. I'm also at Tanisha Psyd, which is PSYD, on Instagram and on TikTok and on Twitter. If you want to drop a message there, there's lots of ways to get in touch, and I can point you in the right direction. In terms of finding therapists, there are so many directories now. It's really nice to see. In my book, Finding Your Person, there are a list of different directories, but like Therapy
Amazing.
for Black Girls is one that I'm on. And then there's also the companion, Therapy for Black Men. So
Thank
where
you.
you can find a therapist specifically to work with, who has experience of working with Black people. Um, and but there's also other ones. There are places where you can find Christian therapists, Latina therapists. You can figure out what matters to you, and then you can find it. It's going to take some time though. And one of the things that I always say to all my clients is the work that you're putting into creating the life that you want is difficult, but you are worth the trouble. And
Woo.
so if you find that it's a difficult journey, please know I understand it's demoralizing. I try my best to help. Um, when I get calls, even if I miss the message or I miss the email, if it's weeks and weeks later, I will still get back in touch and I'll say, hey, I didn't notice that I had this message, but I still want to touch base. Are you okay? Do you need any referrals, et cetera, et cetera? Because I know what it's like for people when you call to make a therapy appointment and you don't get any calls back.
Yeah.
And that's really hurtful, and it really makes you feel like it's not worth it. But always remember that whatever trouble you're going to make sure that your life is what you want it to be, you're worth it.
And on that note, Thank you, Dr. Tanisha M. Ranger out of the Las Vegas Valley area. It is such an honor to have you on the show, Dr. Ranger, from my organization, Agile Evolutionary Group, to your consulting work. Happy Black History Month.
Happy Black History Month.
And on that note, everybody, thank you for listening. I know that this episode has helped me with a lot of individual strategies. I hope that this helped you too. So onward and upward, everybody. Take care. Talk to you soon.